Hi. Okay, so I think it's my job to say something about the 5-year forward view, where we're going, and in the process say a bit about what we've done so far. And if we have time at the end, we could talk a little bit about what the risks are. But I'm aware I've got 15 minutes, so forgive me for going a little bit fast. So this slide is probably the best known slide in mental health. It summarises the task force and how they delivered the 5-year forward view. It involved consulting with about 20,000 people, service users, professionals, etc. And they came up with 3 major themes. One is that people want high quality 7-day services. I mean, as if they'd want low quality ones. Integration of mental and physical health, and prevention or early intervention. Now, there are lots and lots of other things, loads of recommendations across lots of different bodies within the NHS and government. But essentially, it amounts to £1 billion, or reaching £1 billion for adults by 2021. Now, I didn't have anything to do with developing the 5-year forward. I came in as National Clinical Director after it had been produced. So it was sort of my first thought was, let's try and make some sense of it. So this is what I think are the sort of high-level direction of travel for the 5-year forward. So the first one, I think there's a message that says we are reducing our dependence on institutional responses. Okay, so if you look all the way through it, it doesn't say anything about increasing beds, having more forensic beds, etc., with one exception, which is perinatal. Now, we'll come to that in a minute. There is a new exception which has been added, which is for a short period of time that we are expanding access to tier 4 beds for children and young people. But that, I must stress, is short-lived. Second thing is to create alternatives to admission. So although we are increasing perinatal beds and building 3 new MBUs, we're also putting a big investment in community services. And that goes across acute care or crisis care and so on. Third point is integrating mental health. Now, you'll see it says integrate mental health in with physical health, and that's very obvious. We'll come to that in a minute. But it's integrating mental health across the board. And that includes thinking about new ways in which we might integrate mental health in schools, in social care, etc. Fourth key point is that we need to be enhancing mental health services right across the age range. So from perinatal services right the way through to older people. And the final piece, which I think runs throughout the 5-year forward view, is that whatever we are setting up, let's set up services that work so that they've got some evidence behind them. Okay, again, this slide is probably pretty well known. 12 boxes, each one a target. And I can't cover all of them, so you'll see at the top left-hand corner, we're saying we're going to see 70,000 more children, and we've got 10% reduction in suicide. We can talk about that. So any of these, but I can't cover them all. There's too much in there. So I'm going to start off with what we're doing about perinatal. So as you can see, 4 new mother and baby units. They've already been identified. They're in areas where currently people have to travel huge distances to get them. We're setting up community-based perinatal services. As we started this, only 15% of the country had perinatal community-based services. So we're aiming to cover, by 2021, cover the whole country. So that's perinatal. Children, as I said, 70,000 more children. Now, sounds like quite a lot. Percentage-wise, that's an 8% increase in the number of kids that we're seeing, okay? So at this point in time, if you go out into the community and you interview children, do a clinical interview with them, you will find 4 times as many of them than you will see represented in CAMS services. So CAMS are only seeing 1 in 4 children who've got a mental health problem. This will bump that figure up to 33%, so from 1 in 4 to 1 in 3. And you know, I'm sure all of you who didn't know that will feel slightly uncomfortable that that's all we're managing to do, and we can talk a bit more about that too. Another one that we're doing is that we're encouraging localities to take over what currently are tertiary beds in Tier 4 CAMS. And the point of that is to try and reconnect institutional responses to children and young people back to their localities. Currently, as I'm sure you know, there are lots of stories of people of kids who are taken sometimes 200 kilometres, 200 miles away from their home to be able to get treatment, whether that's for eating disorders or indeed for kids who've got major behavioural problems or psychosis. So we want to reconnect Tier 4 beds with their local community. And in so doing, move some of those resources back into community services. Okay, so what will that amount to? That'll amount to 35,000 more children over the next year. That will amount to about 170 million investment. I should have said that alongside the aim to get up to £1 billion extra per year into adult services, we are over a 4-year period investing 1.4 billion, 1.4 billion into CAMS services. So 170 million over the next year. Now, that 8% increase isn't satisfactory for either Number 10 or the Secretary of State, and the Secretary of State for Health and the Secretary of State for Education are currently working on a green paper to try and see if we can't reach the other 66% that the current plans don't reach. And it was our collective view that the right place to do that would be to go into schools. So the green paper will be about the mental health of children in schools, and obviously we're all keeping our fingers crossed that that will, in the long run, lead to a significant investment into children's mental health in schools, but we are also hoping that schools will embrace that and own it as part of what they do. But we'll see. Green papers, that's not for us to produce, but it is for us to have a view on them. Okay, next one, 60% of people, this is one of the waiting times that we've introduced. 60% of people who have a first episode psychosis should be starting treatment within 2 weeks. Now, we are actually achieving that in large parts of the country. I think we're up at about an average of about 65 to 70% of people being seen. And for treatment starting. So over the next year, that would be 10,000 more people. Now, I should say, interesting fact here is that we made our estimates of incidence, so that's new cases of psychosis, on the basis of the best epidemiological evidence we've got. And it looks like most parts of the country, we've underestimated by about half. So we've got effectively double the number of people than we expected coming into early intervention services. That was not expected. It looks as if, because we're now saying we will help you within 2 weeks, more people are coming forward, which is a big surprise because most of us thought, well, if you've got psychosis, you're bound to come into services. But actually, that appears not to have been true. We're investing, again, most people probably don't know this, we've put £49 million into CCGs this year, starting this April, to go into crisis teams. So in my hometown of Sheffield, that's 1% of the population, so we should have £500,000 approximately going into our crisis teams. I don't think we've seen it as yet, but we can only hope. Another one is a corollary of that investment is that we should have lower out-of-area placements. There are currently 10 trusts around the country who have no out-of-area placements, including my own, for the last 3 years. So we are going to help all the other trusts, all 46 of them, to get their out-of-area placements down to 0 within 3 years. Oh, I'm ahead of myself, so I'll skip that. Nearly coming to the end. Currently, people with anxiety and depression, we see 15% of people who have anxiety and depression, adults, in our IAPT service. Doesn't mean to say that GPs don't see lots of others, but in terms of getting psychological treatments, which are the first port of call in NICE guidance, only 15% are getting that. So there's a big investment to increase the number of therapists in IAPT by 3,000, and that we expect will increase our reach by 10%. So 25% of people should be seen, and that will be focused on 2 groups that currently don't get much in the way of psychological help: people with long-term conditions who have high rates of psychological problems, and people with medically unexplained symptoms who currently cost about £3 billion to the NHS. A third of people going into acute hospital outpatients turn out not to have a physical health problem, but have a mental health problem. So that's what we've done with those. Over the last year, 600 new therapist training, etc. And we are hitting our targets in terms of waiting times for IAPT. Okay, then in other areas which I don't have time to go into, and I think I've run out of time now. I'm okay, a couple of minutes, okay. New models of care in forensic services. So one of the things that I did in my trust with colleagues, lots of us did it together, was to find all the people who'd been in forensic care and then put into locked rehab, and then we brought almost all of them back. Some have remained in institutional care that we've brought them back to, but the majority, vast majority, we've put them into the community with standard tenancies and used the huge amounts of money that are tied up in forensic and locked rehab to invest in ultra-intensive community treatment teams that provide care 24/7. Okay? Now, we want to do that with all the forensic ones as far as we can. That's not taking people who are currently very dangerous or currently harming themselves greatly and just dumping them in the community. It's gradually helping them reconnect with the community from where they've come. So we're doing that with, as I say, Tier 4 CAMs, but also forensic across the country. I mean, I don't know if you know, but there's forensic services, a £1.1 billion spend currently, so that's not huge numbers of people. And alongside that, there's locked rehab, which is about a £900 million spend. So we're talking about £2 billion on institutional care that we think we could spend better on community-based care backed up by some institutional responses. Digitalisation. We've set up 7 global digital exemplars. Each have got £10 million. That's going to be followed We hope by some more investment to get mental health up to speed. Now, I say up to speed, mental health is probably ahead of most of the rest of health in terms of getting everyone with an electronic patient record and using digital innovations. So we want to spread that. And I'm chairing a nice digital therapies committee, which is going to start putting out by the end of this year, we'll be putting what are called blended digital therapies out into the NHS. So there'll be a combination of face-to-face work, and then between face-to-face times, you'll do digital work. As I say, out area placements, that's locked rehab, tier 4 CAMS, but also acute, so we want to get all of those down. Suicide prevention strategy, which I imagine Gregor might say something about. And we should, by the end of, by April of next year, start investing £25 million to bring the suicide rate down by 10%. And then there's lots of incentives in the system. So I'm going to call it a day. You'll be able to get my slides. Those are the key issues. If you want to ask anything about them, these are the risks or the problems that we think we're going to face in getting all this into practice. So please do ask questions later. Yeah? Okay. Thank you.